Hello, I'm Ed Murphy of Plant Moran Group Benefit Advisors. I'm here today to talk to you about the Patient Protection and Affordable Care Act. Today's topic is designed to wrap up all that we have discussed and provide our thoughts on strategy and implementation. But first, a disclaimer. The information we have presented is accurate based on our understanding of the law and the guidance to date from the IRS, Department of Labor, and Health and Human Services Department. However, every employer situation is unique. Your businesses are different, just as is your staffing, work schedules, and benefit plans. As a result, we can offer directional information about the Affordable Care Act, but without intimate knowledge about your situation, we are not positioned to provide clear recommendations on what you should do to comply, or frankly, even if the Act applies to your firm. Therefore, here's our top 10 list of things to consider as you move forward. Number 1, begin with knowing if the shared responsibility rules apply to you. Remember, this applies to large employers, those defined as having 50 or more full-time or full-time equivalent employees. Number 2, don't overlook your relationship with other firms. The rules of aggregation apply when determining large employer status. Number 3, seasonal help may be excluded for the purposes of determining large employer status. Number 4, if you're a large employer, thoroughly evaluate the staff that meets the 30-hour per week requirement. Remember, you include all part-timers in determining large employer status, but once determined, you need only offer benefits to those working 30 or more hours. Number 5, be sure you understand the cost implications of including those working 30 hours. Many of you have a current plan design that may require 35 or more hours for eligibility. The Affordable Care Act extends that down to 30 hours per week. Failing to offer affordable benefits to a group could be an extremely costly oversight. Number 6, review the safe harbors for affordability. They are the W-2 rule, the rate of pay rule, the poverty line safe harbor. Any one of these 3 qualifies the plan as being affordable. Number 7, if your current plan is not affordable, revisit the requirements for meeting the essential health benefits. You may find that you can introduce a new, lesser valued plan that makes the entire plan in total more affordable. Number 8, start early. This is not the year to begin planning renewal strategy 2 or 3 months before the effective date. Number 9, recognize that you may be provided transitional relief in terms of the effective date. Plans with a non-January 1 plan anniversary that were in effect as of December 27th, 2012, may have a longer period of time to comply with the Act. And number 10, seek advice and support from your professional advisors. This is a complex law, and the penalties are not insignificant. In closing, thanks for listening as we provide our understanding on the Affordable Care Act. We hope these sessions have been beneficial.